I'm Dr. Robert Stevens. I am the medical director and co-founder of the Men's Health Clinic. I wanted to make a difference. It sounds very cliched, but it's true. I wasn't interested in business and anything else out there. I was interested in nature, interested in the human experience. That was the fundamental reason why I wanted to become a doctor. It was actually initiated by going on holiday and seeing a poor girl with cerebral palsy and how she was struggling. I thought, how can I potentially help that person? And again, it's about affecting a positive change to the individual. I became a TRT doctor because I was disillusioned with the model that I was complicit in. Stumbled upon it really from watching the UFC and all of these fighters coming back on their therapeutic use exemptions, and it was obviously because they've been banging in gear and overdoing it from a physical perspective. And this testosterone word, it's like, obviously we learn a little bit about testosterone in medical school, but not much at all. And I started investigating it and realized there was a shortcoming in service and care, and thought, I can capitalize on this. Not from a financial perspective, but actually I can positively affect a change to the individual and men as a whole, because men don't get a fair deal when it comes to accessing healthcare and service. Rather selfishly, I thought I might need testosterone as well. So I thought, let's become an expert in the field. It wasn't done very well. That was very clear. And I thought, I can do this better. Really, that was it. It was like, yeah, I can affect a positive change far more than what's available, because we could give them the time and the expertise from the fact that this is all I do. Literally, this is all I do. So yeah, it was a field that I wanted to specialize in because of selfish reasons and the fact I could affect a change.
What do you think one of the biggest misconceptions about TRT is?
About being jacked, and it's for grumpy old men. Testosterone is necessary for normal physiology. What is normal physiology? How your body functions. So it's integral to leading a life worth living. There are lots of social media gurus out there promoting testosterone replacement therapy at the moment. And again, they're selling a false promise and not delivering realistic expectations, because it's just normalization. And that's literally it. It's not about being a superhuman if you're not a superhuman. It's been an evolution of practice. So we adhered to the UK guidelines in delivering libido and testosterone gel, but we found it to be completely ineffective in achieving what we wanted to achieve, which was stable male androgen levels. So the model evolved into more of an American style model, which was more frequent dosing. But the Americans are the Americans, and more is better, but more is not better when it comes to the body. So our microdosing TRT methodology was an evolution of practice, understanding what happened to our patients with more frequent injections, but with higher doses made no sense. So it became about normalizing physiology, and less is more when it comes to the body. It's about minimum effective dose. Are there unexpected things? Loads. But yeah, I mean, it's been 8 years of growth, continued evolution, and it's like the iceberg of success, isn't it? What you see is the pinnacle, but underneath there's 2/3 that's lots and lots is going on. It's constantly evolving. It's great that we're raising awareness. And hopefully improving understanding about this condition. I suppose I should feel proud, but we're not like the rest. When we always want to be leading the way, so setting the standard. So I think disappointingly, lots of companies are seen as a cash cow, and we're always acting in their best, in the patient's best interest. We have we just had a chat with one of the guys that procures our Examestane, and other clinics don't use it because there's no money to be made on it. And again, we're always acting in the best interest of the patient. We're not interested in profit, we're interested in outcomes, and that outcome is the patient. It's not that, which is the focus of a lot of companies. as I said, we live and breathe this stuff. We've been doing it for 8 years, 4,000 plus patients from 50 different countries. There's a reason why people travel all over the world to come to the clinic. It's not only our microdosing TRT methodology, which is mimicking physiology, which should be the premise behind everything outside of correcting pathology. My Noddy Car videos, when I talk about testosterone, TRT, have a rant, it's realistic. And I think there's hopefully a level of integrity and empathy that gets portrayed, because essentially I'm talking to myself and my iPhone. So there's no agenda. I'm literally giving you what you need to hear, or what I think you need to hear. And I think people appreciate that. It's busy. You know, we work incredibly hard. Starts off with diagnostic calls, and then it's consultations until Lydia calls me into her office to reprimand me for something, and then I get given a whole load more jobs to do. And then I go home like, you know, a shell of my former self. No. I absolutely love my job, but it's hard work, and it's not the medicine. The medicine's pretty damn easy. It's dealing with the patient. It's giving them the realistic expectations, giving them that appreciation that we're all on the same journey. We've been here thousands of times before. I've had the honor of having 4,000 plus patients sat in front of me, so I can be objective in your subjective experience. So it's managing that. That's the tricky part, because if you feel rubbish, you feel rubbish. Do you want to feel rubbish? No. But I can't cure you overnight. How you feel right now is how you feel right now. So it's about delivering those realistic expectations in the correct way to say to a patient, you'll be fine. Anything negative is temporary. Anything positive is also temporary. It's about continued work on this journey to hormone optimization. It's a journey, and you need to appreciate every single moment. And I think that's the key. But again, you need to understand where you are on your journey, and what you want to feel better right now. It's not realistic. You have to trust the process. The one thing I would like all men to know, and all women to know, frankly, because now we do female HRT, is that you are your hormones. So hormones are chemical messengers that help facilitate the function of their target organ. That's the textbook answer to that question. But hormones, if you think about a pyramid, think about the base of the pyramid being your hormones, and there's a chronicity to that, okay? And above that, you've got your acute nervous system, and above that, you've got your reactive brain. Without that foundation, without that base, you've got an acute nervous system and a reactive brain trying to find answers, but you can't find the answers because you don't have that foundation. So again, it's the building blocks, but it's the foundation of life. You are your hormones. With the increased awareness and understanding, I would love to say there'll be improved access to safe and effective care. I don't think that's the case. So I think there are going to be tighter regulations in the future because of these online companies promoting TRT as a cure-all, fix-all. So the traditional healthcare systems are pretty regressive, but they're safe, but they're not necessarily in the best interest of the patient. I think disappointingly, or actually reassuringly, it's become even highly even more highly regulated, because it's about safe practice. Now, we know that the traditional healthcare model is safe, but is it effective? So we need to blend those two in. So I think, again, hopefully we're obviously pioneering the way into making patients feel good, but also demonstrating safe and effective practice for then the traditional healthcare model to go, hold on, yeah, these guys are doing some good. Should we look to adopt that same methodology? And whilst I would love to see, the NHS would do that, you know how involved we are with our patients, and the NHS hasn't got the capacity or inclination to do it. And I think partly that's because lots of research is funded by the pharmaceutical industry, and there's not much money to be made in testosterone. There's lots of money to be made in antidepressants and diabetic drugs, blood pressure medications. And talking about prevention, lead a healthy life. We spend so much of our time talking about sleep hygiene, stress reduction, nutrition, exercise, and mindset. You go to a doctor who's got 10 minutes, he's got 20 patients. He hasn't got the time to actually go into any detail about what you should be doing. So I think it's about taking personal responsibility. But the problem is this takes time, and there isn't a quick fix. And we all in this modern society, we want a quick fix. Now, there's an immediacy to it. So again, it's just taking that step back and just going, right, okay, what can I do to affect a positive change to my health? And I'm going to take personal responsibility, because I'm not going to get it from them. I'm going to get it from the Men's Health Clinic. I'm just myself. I am blind, which is probably slightly unprofessional, but it's to try and break down those barriers of clinician and patient. I think you need to be relatable. I think you need to have demonstrate empathy, not sympathy. And again, there's no sugarcoating anything. You're going to hear what you need to hear. It may not be what you want to hear, but it's what you need to hear. And I think that's the key. And I think people respect that. You're never going to get a false sell. You're never get any bullshit from us. You'll be told what you need to hear. Being a doctor is difficult because you're not interested in happy patients. You're only interested in the people who are struggling. TRT is about making you the best version of yourself. Knowing that we've positively affected the lives of everybody that we've come into contact with. We now understand the importance of hormones in mental health. So I had a patient, it was a few months ago now, and I was trying to motivate him as I try and motivate everybody, you know, be the best version of yourself. I couldn't get anything out of him. I just couldn't. There was nothing going on. And I said to him, do you think TRT is working? And he said, I don't want to kill myself. Fuck. Crazy. It's the suicidal guys. We're shaving lives.
Yeah, but that's what
Fuck.
it sounds cheesy.